Hello everyone, welcome back to our channel. I'm Dr. Ashmita. Today, let's study about chronic hepatitis. What is chronic hepatitis? Hepatitis is inflammation of the liver parenchyma. When we add the term chronic means it has a prolonged duration. So, any inflammation of the liver that has a prolonged course is called a chronic hepatitis. Therefore, it is defined as a condition characterized by persistent inflammation of the liver lasting for more than 6 months. So, it is the persistent inflammation of the liver that lasts for more than or equal to 6 months duration is called a chronic hepatitis. We have discussed about acute hepatitis where the duration is less than 6 months. So, chronicity means more than 6 months. Persistent inflammation of the liver lasting for more than 6 months is chronic inflammation, and it is associated with ongoing hepatocellular hepatocellular injury and necrosis. There will be injury to the liver cells and also necrosis, which is one form of cell death. And it may progress to fibrosis, cirrhosis, and hepatocellular carcinoma. If it is left untreated, it may progress to fibrosis, cirrhosis, and hepatocellular carcinoma. As we have discussed in acute hepatitis, where whenever there is a liver cell injury, the liver cell enzymes, what are the enzymes present within the liver cell? Transaminases, ALT and AST. They are present in the liver cells, they leak out into the circulation. So we can correlate it with the lab test where they show increase in alanine and aspartate transaminases. So chronic hepatitis is characterized by hepatocellular injury and necrosis. If left untreated, it may progress to fibrosis, cirrhosis, hepatocellular carcinoma. Now, let's see about the etiology of chronic hepatitis. Here, age and sex has a role to play because neonates. In neonates, there is immature immune clearance mechanisms. Immature immune clearance. Because of immature immune clearance, the offending agent causing chronic hepatitis will stay. They are not cleared completely. So the neonates, 90% of the neonates, they are prone for chronicity of hepatitis whenever any offending agent is persistent. And sex, coming to the sex, males are like predominantly affected. Males have preponderance for chronic hepatitis because in males they lack estrogen. Males, they lack estrogen. Estrogen is believed to have a protective factor or an anti-inflammatory effect. It has an anti-inflammatory effect on the liver. So males lack estrogen, and also males have androgens. They have androgens. Androgens will cause increase in oxidative stress. They increase in oxidative stress and cause enhance the fibrosis of liver. Therefore, males are more commonly affected with chronic hepatitis. These two are the additional factors which add up to chronic hepatitis. So, what are the actual causative agents for chronic hepatitis? It can be classified as viral, alcoholic hepatitis, metabolic, drug-induced hepatitis, autoimmune, and other causes. Among the viral, hepatitis B, C, D. So, hepatitis B, C, and D, they are more commonly lead to chronic hepatitis, more commonly associated with chronicity. Hepatitis virus B, C, and D. So, hepatitis B, C, D, they are most commonly associated with chronicity. Chronicity with E is extremely rare, but it can occur in immunosuppressed patients. In hepatitis A, they occur in immunosuppressed in immunosuppression. So, chronicity with hepatitis E is extremely rare. If it occurs, it is seen in immunosuppression. But chronicity with hepatitis B, C, and D are more commonly associated with chronic nature. And there are like co-infections and synergistic etiology. Co-infection means two viruses they coexist, or synergistic means infection with the other virus will add as a catalyst to the ongoing infection. For example, hepatitis B and D. Hepatitis D is a virus that is dependent on B. So whenever there is a co-infection with B and D, BD virus, they will cause or they will may progress to cirrhosis and hepatocellular carcinoma. BD will cause cirrhosis and HCC. Whereas hepatitis B and hepatitis C, they are associated with high risk of chronicity and HCC. So we have discussed in the etiology of acute viral hepatitis. I have said the mnemonic for acute viral hepatitis, that which viruses cause chronicity. For chronicity, I have said the mnemonic BCD. C for hepatitis C, B and D, more commonly associated with chronicity or carrier state also. So hepatitis B and C will cause high risk of chronicity, and chronicity means more exposure to the virus, prolonged exposure. Therefore, they are more prone for the risk of hepatocellular carcinoma. So, high risk of chronicity in HCC with hepatitis B and C. BD will be associated with cirrhosis HCC. Coming other synergistic role, HCV and HIV. So, co-infection of this HCV and HIV is associated with liver fibrosis and immune dysfunction. They cause HIV, HCV will cause liver fibrosis, immune dysfunction. Coming to the alcoholic hepatitis, prolonged intake, prolonged ingestion of alcohol, they are associated with hepatocyte injury. Alcohol causes hepatocyte injury. Injury is associated with inflammation. And when this inflammation is persistent, when this offending agent alcohol is like persistent, when he consumes alcohol for a prolonged duration, the inflammation will be persistent. Persistence of inflammation is called chronic hepatitis. So, alcohol can cause chronic hepatitis. Coming to the metabolic causes. Metabolic causes, there are few entities like non-alcoholic fatty liver disease, that is abbreviated as NAFLD, or the non-alcoholic steatohepatitis. So non-alcoholic causes are non-alcoholic fatty liver disease, non-alcoholic steatohepatitis, these two, and other metabolic causes being the Wilson disease, that is copper metabolism problem, alpha-1 antitrypsin deficiency, which is a genetic deficiency, and hemochromatosis, iron overload conditions. So let's revise. Metabolic causes for chronic hepatitis are non-alcoholic fatty liver disease, non-alcoholic steatohepatitis, that is abbreviated as NASH, Wilson's disease, alpha-1 antitrypsin deficiency, and hemochromatosis. These are the metabolic causes. Coming to the drug-induced causes, isoniazid, methotrexate, amiodarone, and statins, and few other drugs also. But these are the most common drugs which are associated with chronic hepatitis. Their usage will lead to chronic hepatitis. Chronic hepatitis means even after stopping this drug, the inflammation and damage to the liver cells will continue. So, whenever a patient is put on this isoniazid or methotrexate or amiodarone or the statins, and when we monitor the LFT, whenever there's a derangement in the values of LFT, even after discontinuing this drug, even after the physician when he discontinues this drug, there will be ongoing or progressive damage to the liver cells. The inflammation and damage will continue even after stopping this drug. And this inflammation and damage will be like persistent for more than 6 months even after stopping this drug. Therefore, it is called chronic drug-induced hepatitis. Chronic drug-induced hepatitis. Coming to the autoimmune causes are because of immune-mediated attack on the hepatocytes. So there is a chronic immune response against this hepatocytes which will lead to autoimmune hepatitis, which is of chronic nature. Coming to the other causes, there will be history of immunosuppression. Whenever the patient is put on immunosuppressants, so he will be more prone to infections. So whenever he is infected, the infective agent cannot be eradicated completely, and therefore there will be chronic exposure to the infectious agent that will lead to chronic hepatitis. So these are the causes for chronic hepatitis. So in our next video, in our upcoming videos, we'll discuss in detail about each of these etiologies like viral hepatitis, chronic viral hepatitis, alcoholic hepatitis, or autoimmune hepatitis. So do follow our channel for these updates and stay tuned to our channel. If you like this video, please like, share, and subscribe. Thank you.